It can take a long time to recover after a stroke. It is common for people who have had a stroke to have problems that can affect their daily life. Some of these will improve over time, but others may not change. The effects caused by the stroke differ from person to person. Common problems include difficulties in speaking, understanding, and thinking, changes in mood, difficulties moving and looking after themselves. The person affected by stroke will need help in these areas to recover and avoid further problems. Some of the common problems that happen following a stroke are related to eating and drinking and may include incomplete closure of the mouth, an inability to move food around the mouth, resulting in dribbling and pocketing of food. Coughing after eating as food is entering the airway rather than passing into the stomach. If a large piece of food passes into the airway, then this can result in choking. Half of the people who have a stroke have swallowing difficulties. Some problems resolve over the first weeks and months of stroke, but some patients continue to have swallowing difficulties. The person affected by stroke may not be aware of their swallowing difficulties. Swallowing involves the complex coordination of muscles and nerves to get the food and drink to the mouth, chewed and moved from the mouth down the throat to the stomach. Stroke makes the muscles in the mouth and the throat weak, which means that food and drink can leak into the lungs. This can lead to problems such as a chest infection. Allow sufficient time for the meal so that the person isn't rushing.
Let me turn off the TV so that you can concentrate more on your meal. Let me get you a cushion to make sure that you are sitting up properly to make your swallow safer.
Make sure the person is sitting in a quiet environment so they are not distracted and can concentrate on swallowing. Sit upright. Tuck the chin in slightly as it makes it easier for the person to swallow properly. Check whether the person can see the food and drink and that they are able to reach it. Provide cups and utensils that makes it easier for the person to eat and drink. Make sure that the food and drink are the correct thickness for them to swallow. Some people will need help with eating and drinking. Others may need encouraging to finish their meals. Eating and drinking can be tiring when a person has swallowing problems. Make sure that they take enough to eat and drink. Make sure that there is nothing left in the mouth after the swallow and especially at the end of the meal. The person's ability to swallow properly may change throughout the day. You should be aware of the signs that food and drink may be going into the lungs. Choking, coughing, wet voice after the swallow, development of chest infection. If you notice any fever, worsening cough, shortness of breath on a regular basis, then you should speak to your doctor.